Welcome. Welcome to Lincoln University for people that are our guests today, to my colleagues, to this wonderful new building that will be officially opened very soon. We are here for the excellent series, and we will actually listen to Mike talking about oxygen and why that is important. But before we do so, should work. Why doesn't it work? Work. A little bit of housekeeping. We do not expect any fire drills. So if we hear the alarm going, it is the real deal. What we do is we will evacuate this building. Brenda, myself, Maura will assist you going out. We're probably going to take those doors out there, and we gather on the lawn outside. If you want to use the facilities, the toilets, just outside this door. And after we hear the talk, there will be refreshments offered. We will be serving alcoholic beverages. Feel free to enjoy them, but make sure that you realize that your whānau wants your home safe. So please drink responsibly. What I'll do now is I'll introduce you to our Vice Chancellor, Professor Grant Edwards, who will take over the ceremony of this evening. Grant.
Thank you, Vim.
I'll flip to the next.
Okay. Good afternoon, everyone. My name is Grant Edwards. I'm the Vice Chancellor here at Te Whare Wanaka Aoraki Lincoln University. And it's a pleasure to be able to introduce Mike Hamlin here today in an excellent series. It is through our excellent series that Lincoln University is privileged to be able to contribute deeply to the public debate around things that are important from a research and some of the key issues that are facing our country at this point in time. Well-being and the link between sport, recreation, is some important aspects of that. And Mike will allude to those today. In introducing Mike, we're going to hear from Mike today as he explores the beneficial health and athletic performance levels of low oxygen levels. A little bit about Mike. He's currently chair of the university's Environment, Society and Design Research Committee and director of our Sport and Exercise Laboratory, and is currently a sports scholarship academic advisor here at the university. He's a fellow of the American College of Sports Medicine and the European College of Sports Science as well. I think one thing that's really important is that he's both an advisor, consultant, and practitioner to a variety of national government sports bodies, including those where he maintains a close relationship with Sport Canterbury. I think one thing I've come to appreciate that in 2012, he helped negotiate quite a unique memorandum of understanding between High Performance Sport New Zealand around the provision of suitable tertiary support for elite athletes in New Zealand, using Lincoln University as an example, and providing an opportunity for students, elite sport people, to continue to study while representing New Zealand in their chosen sport. And that's quite a significant contribution. Mike specializes in his research and the effects of exercise on human physiology, and is a world expert in altitude training in particular. And we'll hear some more about that today. Having improved his altitude training can be effective alternative to real altitude sojourns. His research is used to set altitude training guidelines for elite athletes, including those of the British and Irish Lions rugby team, and has provided consultation for Olympic athletes such as the New Zealand and Netherlands triathlons teams. We welcome Mike here today, and I'm delighted to hear his contribution and his excellence.
I think it works, Mike.
Okay. Thank you very much, Grant. So what I want to do today is basically take you on a snapshot journey of my research career. And I haven't started with altitude because I didn't actually start in altitude. I started back in Otago about 30 years ago, and there was a couple of us wanting to do a PhD, and we were both interested in racehorses at the time. And there wasn't much scientific training on racehorses at that time. And so we thought, well, the knowledge that we've gained through phys ed school and our masters in training athletes, we might be able to use that to train trotters and pacers. And then we might actually use that to win some money, but that didn't really happen. So what we were interested in was to use the principles that we've learned from human athletes and apply that to racehorses. And one of the ways you can look at that is to use this general adaptation syndrome, which highlights the stress response quite nicely. So when you train somebody, you put them under stress, and that stress causes a reaction. If we take you and put you on a treadmill, your body's not going to like it for a start. Your performance will drop. You'll start to break down your own tissue. But eventually, if we do that for 2 or 3 days a week for 3 or 4 months, you will actually adapt, and you'll get resistance to that stress, and you will improve your performance. You'll lay down new tissue, increase your proteins, enzymes, and so on. And it's this that we wanted to look at with the racehorses, right? So one of my colleagues was interested in this, and how can we get the best out of our racehorses? I was interested in the other part, the other stage of this whole paradigm, which is if you push athletes, in this case racehorses, too far, they then start to detrain. They get worse. They start to break down. They don't have enough recovery. And I was really looking for the golden, like a golden piece of information in here where we could give trainers an idea of, oh, you're pushing that racehorse too hard, but come back off on it a little bit. So I was looking for some sort of mechanism that we might use to look at what we call overtraining or exhaustion. And this is straight from my PhD thesis. Excuse any spelling mistakes. And you'll see, don't worry about too much of it, but over here, you can see that the brain is actually involved in this overtraining syndrome. Particularly the anterior pituitary gland, which produces eventually cortisol, which is one of the hormones that start to break down tissue. So at the time of finishing my PhD, I was kind of interested in looking at hormones, and in particular maybe horses, but then of course maybe athletes as well. And at that time I was looking for a position, and there was a job going at Lincoln University. And what caught my eye was, of course, Lincoln University was also the home of Professor Cliff Irvine at that time, who was a very famous veterinarian. He also had his own racehorses. He trained his own racehorses. He raced his own racehorses. But apart from all of that, he was also a researcher, and he was one of the guys that specialised in taking bloods from the hypothalamus of horses without having to sedate them. So he found a way of putting a cannula up through the sinus somewhere, I didn't actually see it, and get blood without having to drug the horse, which would have been perfect for looking at hormones and overtraining and that sort of thing. Unfortunately, about a year or two after I got here, Cliff was involved in a major car accident, and we didn't really connect and do much research. So I turned to athletes again, moved away from horses. There was no money in horses, so get away from them. Back to athletes, and with athletes, you train them, you give them some sort of stress, and hopefully they adapt to that stress. But you're always looking for other ways to stress the athlete. And one way to stress the athlete, apart from training them, is to introduce them to altitude or reduce the amount of oxygen that they're actually breathing. That creates a stress within the body, and then the body has to adapt to that stress and hopefully get better. So oxygen is a very simple molecule, tasteless, odorless, but vital for humans, right? We take in oxygen, we use oxygen to metabolize the food that we've eaten, and we produce energy from that and CO2. And then plants take up CO2 and then produce oxygen. So a very easy way to stress athletes is to reduce the oxygen, and you can do that by taking them to altitude, right? So if you take somebody to altitude, what happens is down here at sea level, the barometric pressure as you go up in altitude decreases, and that decreases the density of the molecules in the air. So there's fewer molecules floating around at higher altitude, and it's harder to get the oxygen in, harder for the athletes to get enough oxygen to metabolize food to create energy. And so it's a very simple way of introducing an extra stress to an athlete to get them to hopefully adapt and improve. But you have to be careful, right? Because there are some cases where too much hypoxia or too high of altitude can be dangerous. So when you go to altitude, there's a number of things that happen. There's some acute things. So if we took you to altitude, we dropped you off at say 3,000, 4,000 meters, some changes happen very quickly in your body. You start to hyperventilate to try and bring in more oxygen. You increase the amount of blood going around your body. You open up your capillaries to try and drop off as much oxygen to the muscle as possible. There are some acute effects and some more chronic effects. If you're at altitude for a bit longer, 2 or 3 weeks, you get an increase in red blood cells, red blood cell formation, because that is a way in which you can carry more oxygen because your system is oxygen deprived. You get an increase in the capillaries and the muscle, so you can drop off more oxygen, and also you get an increase in vasodilators. So some acute and chronic effects. So what do we mean by altitude, and what altitudes are we talking about when we train athletes? So anything up to sort of from 1,500 to 3,000 meters, we call sort of moderate to high altitude. And most people will be able to handle that fairly easily. 3,000 to 5,000 meters is like high altitude or very high altitude. You start to get some detrimental effects of altitude there. You start to get some tingling, nausea, stomach problems. But again, if you stay for a wee while, those things tend to reduce. If you go to up to 5,000 or over 5,000 meters, that is extreme altitude. That's where the problems start to occur, the major problems. And of course, if you go up to something like 8,000 meters, it's almost impossible to survive without supplemental oxygen. So there are some good things about oxygen and how we use oxygen for athletes, but also you have to be mindful of the harmful things, right? So when you go to altitude, some people get this, what we call acute mountain sickness, acute things like nausea, maybe lightheadedness, discomfort, stomach problems. But if you're there for a wee while, they tend to go, or you can go down in altitude and they tend to disappear pretty quickly. But the more serious things are when you go to higher altitude and you're up there for a long period of time. High altitude pulmonary edema is when you go to altitude and you get water in the lungs. What happens is you have an increase in blood flow to try and get more oxygen into the system. That increased blood flow goes to the lungs. It's a high pressure environment, and it's forcing blood through the small capillaries of the lungs. It forces some of the fluid from the blood out into the lungs. And once you get some fluid into the lungs, there's no oxygen going to get across. So it's very dangerous. Also, just as dangerous is high altitude cerebral edema, same sort of thing. Your brain requires oxygen all the time. When you go to altitude, again, you've got to, the brain wants the oxygen, so it opens up its capillaries. You get an increase in blood flow from the increase in cardiac output from going to altitude, forcing blood into the brain at a high pressure, and it forces some of the fluid of the blood into the brain. And that causes water in the brain, and that causes some very serious effects, hallucinations, gait problems, inability to walk, confusion. Some of the things that you might hear that high altitude climbers suffer from, and eventually kills them because they make very poor decisions. But we're not talking about that kind of altitude for athletes. We use much lower altitudes, something like 15 to 3,000, maybe 3,500, 4,000 meters. And we only use it sporadically, intermittently. And at those kind of altitudes, we can see changes in the body system that would actually benefit performance. Like we get perhaps an increase in red blood cells, maybe an increase in blood volume. Some changes at the skeletal muscle, like increasing capillaries around the muscle to drop off oxygen, increase in oxidative enzymes and myoglobin and that sort of thing. More efficient lung system, and some biochemical and neuromuscular changes. So the altitude, or the hypoxia, which is a lack of oxygen levels that we use, we're looking at these sorts of changes to try and improve the performance of the athletes. So around about the same time as Professor Irvine had his accident, I met up with John Hamlin, who's in the room tonight. And John was an athlete of his own right then, it probably still is, but also a prolific author and a coach of some very elite athletes, in both in New Zealand and overseas. So me and John hooked up. John's very interested in altitude training for his athletes and maybe for himself. And we wanted to know a little bit more information about it so that we could then use it to see whether it worked or not. So there's a number of ways you can introduce altitude to athletes. The first one is the traditional kind of altitude training. So you hear somebody going to altitude, it usually means that they go up to altitude and stay at altitude for 3 or 4 weeks and get the benefits of staying at altitude at that low oxygen level. The problem with that type of training is that at high altitude, or at the altitude that you're at, you've got a lack of oxygen, right? So when you go to do some really high quality, high intensity activity, you struggle. So your high intensity activity kind of drops away, which is not good for athletes. The types of places I'm talking about, there's a few of them. Colorado Springs, Peru in France, and a whole bunch of places like that. Okay, to get around the problem of going to altitude and not being able to push your athletes really, really hard, is the second type of altitude training, which is you go up to altitude to stay, right, to live, but you come down the mountain to train that really high intensity training. So you're getting the benefits of the altitude, the physiological benefits that occur over time, and you're getting the benefits of maintaining the training performance of your athletes. And there's plenty of places, there's not plenty of places. The problem with this type of training is there's not many places where you can get up a mountain and then down a mountain very quickly. You don't want to be spending all day traveling with your athletes. This is Salt Lake City here. We've tried it in Wanaka. The problem with Wanaka is it's up in the snow farm, it's only about 1,500 meters, so it's not quite high enough for what we want, but it does the job in some cases. Okay, so in New Zealand, we don't really have a place that's high enough to get access to be able to train. We're talking about 3,000 meters, that's the top of Mount Cook, right? You're not going to train up there. So there is another way of training that we use that we've looked at, and that's we call this one live low, train high. So you actually live at sea level, just like you are now, but when you go to train your athlete, you train them in a hypoxic environment. So it's like training up at altitude, and we can do that by training them in a hypoxic chamber or hyperbaric chamber, or we can also get them to breathe hypoxia from a mask. And this is the type of training that we do a lot of. So this is Linda Williamson, who was one of our best probably time trialists, and she's in the old lab that had down by the winery. And so Linda is breathing hypoxia. So over here is a machine, a generator that pushes air into a hypoxicator that sieves out some oxygen, and that low oxygen air then goes into those bags, and she breathes it in as she's exercising, and then breathes out into the room air. So I just put in here human research because human research is a little bit different to normal research you might do on cells or on animals. Human research is a little bit tougher, in my opinion, anyway, because you're dealing with athletes, or you're dealing with humans, right? So they get sick, they get tired, they get frustrated, they forget to wake up in the morning, they change their diet, they don't want to be in a placebo group, their coach doesn't really want them to be involved if they're in a placebo group. So there's always lots of things that you have to try and control when you're dealing with human research. Okay, so what I want to do is sort of take you through a couple of the more important studies that I think have shaped my career. And the first one is with John. And so John Hellemans at that stage was at QE2, and he had a fairly large running group, something like 30 or so people. And so we decided to see whether this hypoxic training, just breathing hypoxic gas, could enhance the performance of these runners. So we split the group into two. Half them, they all trained as normal, and then half them sat down 5 days a week for 90 minutes a day. They breathed hypoxic gas for 5 minutes and then breathed normal gas for 5 minutes. And they did that for 90 minutes. And then the placebo group did exactly the same, but they were actually breathing normal room air. We didn't tell them that. This is important because at the time that we started this, we were getting, shot down by most of the people that were in the research area at that time, like from the States and from Europe, saying there's no way breathing a little bit of hypoxia for a few hours a day is ever going to change the physiology enough to get enough changes to create performance change. And so we were up against it. But that didn't stop us. And in fact, we showed quite clearly, here's the hypoxic group and here's the placebo group, that the hypoxic group improved by about, this is their time trial, this is a 3K time trial run, they got faster by about 1.7 seconds. Now for our athletes, particularly elite athletes, or well-trained athletes in this case, that's not bad. Elite athletes, any change above 0.5% is pretty good. That was 2 days, and 17 days afterwards, they actually improved even more. So this was the first study to show that this type of training actually improved performance of athletes. So we were able to show to these guys over in the States that this does actually work, and you shouldn't really poo-poo it. And so that started the research into hypoxia and oxygen and altitude. One of the other interesting, I think, studies that we looked at was some people came to us and said, well, what about our poor old Crusaders and Highlanders and All Blacks that go and have to play at Johannesburg, which is at 1,750 metres, which is quite, moderate to high altitude. And we all know, we hear stories about, that last 20 minutes where they're gasping for air and it's really, really tough. Is there any way that we could help them overcome that? So this was the study around looking at the pre-acclimatization of athletes before they go to altitude to see whether they could actually handle the altitude a little bit better. So we took again a bunch of rugby players. We gave them similar sort of, hypoxia, 5 minutes on, 5 minutes off for about 2 to 3 weeks. And we took them up to the snow farm and we put them through some training up at the snow farm. And we showed that it does actually work. So pre-acclimatization, just doing this kind of thing does work. Not taken up much because of the playing schedules of the All Blacks and the Crusaders from week to week. They don't have really 2 or 3 weeks to prepare. 1 week they're here, 1 week they're in Johannesburg, the next week they might be in Buenos Aires or somewhere. So that was interesting. I think this study also is very interesting, and it kind of changed my mindset a little bit. It started out fairly simply. What we wanted to do here was to train some road cyclists, some fairly elite road cyclists. And what we did is we got them on the bikes and we got them to breathe hypoxia while they're training. Similar sort of thing, although it was fairly short, just 10 days. They did 90 minutes and they didn't train too hard. It was sort of moderate training. But at the end of it, because these road cyclists are basically aerobic beasts, they go for 100 Ks, 200 Ks, no problem to them. So they have to breathe a lot of oxygen in to metabolize food to create energy for that. But they also every now and then have to catch the bunch or get rid of the bunch. So they also have to have some sprinting ability or some anaerobic ability, be able to produce energy without oxygen. So at the end of it, we decided to give them, at the end of the 90 minutes of aerobic training, we decided to give them 2 30-second all-out sprints. They didn't like it very much, but we thought it was important to be sports specific to try and get to what they are actually doing out on the field. Yeah. Okay, and so what we found is what we thought would be fine, an increase in their aerobic performance. It wasn't statistically significant, but was meaningful, about 2 to 3%. We thought that wasn't too bad for 10 days. What we weren't expecting was an increase in their anaerobic performance. So the anaerobic performance actually improved. And if you think about it, we weren't thinking about it before it wasn't part of the study. But then we thought, well, if you think about it, if you drop the amount of oxygen that somebody can take in, their system's going to say, right, I haven't got enough oxygen to metabolize food aerobically, so I'm going to change to an anaerobic way of, getting enough energy. And so what the athletes have done is they've increased their reliance on their anaerobic systems, like their glycolytic system and their acid buffering system. So that's probably the changes behind what we saw. So we thought, well, if that's the case, why don't we use this type of training on team athletes, like rugby players, like hockey players? Because they need to go for 80 minutes, so they're aerobic, but they also do lots of sprints within that 80 minutes. So they're also anaerobic as well. So this study was looking at using hypoxia to train the repeated sprint ability of the rugby players. So in rugby and hockey and netball, you don't just sprint once, you sprint and then you've got to turn around, the ball's been dropped, you've got to chase back, then you go forward, you've got a repeat sprint. So we were interested in seeing whether this hypoxia would affect the repeated sprint ability. And we thought it should, because that relies on the anaerobic system. And so we found a very nice improvement in that study. And so that's opened up a big area for research for us now. One of my first PhDs started looking at one of the anaerobic systems is strength training, right? The ATP-PC system. And so what she did is said, well, okay, what happens if we train somebody like use a normal strength training program, but we get them to breathe hypoxia at the same time? So this was on some netball scholars that we had. And this person here is doing strength training of the quadriceps muscle here and breathing hypoxia. So this person all their body is hypoxic. This person here, what we did is we put bands, just like when you go to see John and get your blood pressure taken, you get a blood pressure cuff put around your arm. Well, this time we put blood pressure cuffs around the leg, we blew them up. And by doing that, we reduced the blood supply to that part of the leg, and that part of the leg becomes hypoxic. So 2 different ways of using hypoxia, just local hypoxia or systemic or overall hypoxia. And then we had a group that breathed like this, but they were actually getting normoxia. So we had a control group. Okay, and we found really big changes in the cross-sectional area of the muscle of the quadriceps. So this is the MRI scan of one person, and we found really quite substantial increases in their muscle mass. So that training increased hypertrophy compared to the normoxic group, and it also increased their strength and their power. And that opened up a huge series of studies looking at using hypoxia during strength training. And so we've done a lot of research here and in Thailand looking at ways in which we can use hypoxia while strength training. And not only for athletes, because the beauty about using hypoxia with strength training is that you don't need to use the same amount of resistance. You can actually use about 20 to 30%, or say 60 or 70% less than what you normally use. So if you go to the gym, you see the rugby players in there, they're lifting huge weights. We could get the same performance changes using about a 60 to 70% lower weight, which is really important if somebody is rehabbing from injury, if somebody is weak anyway, if somebody's trying to put on muscle mass and they've got very little muscle anyway. So there's some clinical aspects to that would be important as well. Okay, so there's also an area of research that's sort of not as advanced as looking at athletes, but looking at the health effects of hypoxia. So when we use hypoxia, this is us down here in Christchurch at sea level. We have enough oxygen in the air to fully saturate our hemoglobin and get enough oxygen for our bodies. This is somebody up at very high altitude. If you're up there for too long, you have an increased risk of stroke and cardiovascular disease. Where we work at is somewhere in the middle, right? We're trying to find what is the best hypoxic or oxygen concentration where we can get the most benefit for athletes and for everyday participants. But even when we're using this kind of intermittent hypoxia, you have to be careful, because intermittent hypoxia can also be dangerous if it's prolonged and if it's severe. And we can see that from obstructive sleep apnea. So in obstructive sleep apnea, normally when you go to sleep, your airways are open. Obstructive sleep apnea, the glottis closes down, your airways are blocked. And what happens is, this is normally your airflow during sleep. What happens is your airflow stops. You can't breathe. The amount of oxygen in your blood drops way down until eventually you wake yourself up, you start breathing again. But it doesn't just happen once, it happens thousands of times during the night. And it can cause problems like high blood pressure, cardiovascular disease, increased risk of stroke. So we want to keep away from that kind of intermittent hypoxia if we're looking at the health benefits of this kind of paradigm. So if we look at the history of hypoxia and health, way back in 1960, there was a study that found a reduced incidence of heart disease in people that lived at higher altitude. And more recently, this is an interesting study, people that live at altitudes that are above about 450 meters, and I think the highest was about 2,000 meters, they have a reduced, this is the purple guys here, they have a reduced incidence of the metabolic syndrome, a reduced incidence of obesity, stroke, high blood pressure, and diabetes. So there's something about living at altitude that has a beneficial effect on your health. So there's a lot of hypotheses around that. What they think is happening is that you're stressing your cells, and that stress in the cells causes some changes in the cells. You get an increase in the cell survival, you get a decrease in cell breakdown, you get a decrease in inflammation of the cells that lead to some, prevention or health benefit. This is a really interesting study looking at mice and hypoxia. This is just published this year. So these mice are genetically have a genetic predisposition of aging very quickly. So what they did is they got these mice, and at 4 weeks they separated them out. So one group lived in hypoxia, quite high hypoxia to be fair, 5,000 meters or 11%, and the other half lived in normoxia, just normal room air. And they just followed those mice and found that the mice that lived in hypoxia extended their lifespan by about 50%. So they lived longer than the mice that lived in normoxia. So what have we done in this kind of area? We've done a few studies looking at the health benefits of using hypoxia. So Catherine Lismore, that was one of my PhD students, looked at using hypoxia to benefit health in normal people that didn't have any problems, no high blood pressure or anything like that. And so this is the difference between the group that got hypoxia versus the group that didn't get hypoxia. All groups exercised, but after exercise, one group got hypoxia and the other group got just normal air. And what we found is that at 4 weeks and 8 weeks post having this hypoxia, they got a beneficial effect on their blood vessel health. So pulse wave velocity, some people may or may not know what that is. It's how quickly the blood travels through your vessels. So it gives us an idea of vessel health. So the healthier the vessels, the slower the blood goes through the vessels. So a decrease in that pulse wave velocity is actually an improvement in the health of those vessels. So that was really interesting, 8% improvement. Obviously, the people that were in the hypoxia group increased their VO2. In other words, they were able to take more oxygen to produce energy, which we thought would happen. But interestingly, we found a decrease in blood pressure, a slight decrease in blood pressure of these people that didn't have high blood pressure. They were just normal people. So that was quite interesting. And so we did a follow-up study with my colleagues in Thailand. And in this case, what we did is we used hypertensive people that already had high blood pressure. And we had 3 groups. We had a group that was a control group. We had a group that exercised while breathing hypoxia, and a group that exercised and then got hypoxia later. And the 2 hypoxic groups had a significant decrease in systolic blood pressure at 2 and 28 days after the treatment. So it looked as though we were able to show a chronic and then acute and then a chronic drop in blood pressure to levels which would normally need pharmacological agents, pills from your doctor. So clinically worthwhile drops in blood pressure for these people that were hypertensive. This group also wanted to look at some of the mechanisms, and we found that nitric oxide is probably the mechanism behind that drop in blood pressure. Okay, so going forward, where do we see our research going? Well, we need to sort of figure out which hypoxic level is best. We know that if you go too low, it's dangerous for too long, and going too high, you're not going to get enough adaptation, either for an athlete or for a normal person. And we know that too many cycles per day, like obstructive sleep apnea, is very dangerous for you. But having too few cycles a day probably is not going to do, much. So we need to figure out, how many cycles a day we're going to use. So the research going forward, we need to find what the appropriate stimulus is, what sort of dose do we give somebody, and is it the same for everyone? We don't have a lot of information on the clinical benefits of hypoxia, so more clinical studies around, the health of the cardiovascular health benefits of using hypoxia would be worthwhile. And hopefully we're going to do some of those. And in all instances, one of the things that we do struggle with is standardizing the dose. So if I have somebody sitting in that chair and somebody is sitting in that chair and I give them 15% oxygen, this person may take that 15% oxygen and be completely different in terms of their adaptation to that to this person here. So how do we standardize the dose for everyone so it's exactly the same is another area that needs sort of fleshing out. Okay, so like any research, you're not doing it in a vacuum. And so I want to thank all of my research associates and colleagues. I don't know whether I've got all their pictures there, but, they are, have a lot to do with a lot of the research that I do. And I want to personally thank them. Thank you.
Thank you very much, Mike. That's an absolutely enlightening presentation. There's an opportunity to ask some questions of Mike at this point in time, and I'm sure there are some out there in the audience. Because if you don't, I'll start. But, John.
Sorry, Mike. Can you comment on the notion of responders versus non-responders? Because that's a huge topic amongst the scientific community, and probably one of the reasons why there has been so much suspicion around the benefits of altitude training, in particular in athletics. So what do you know about that?
Yeah, so there's two schools of thought. If you talk to the American guys that said, you have to go to altitude to get a change in performance, they would say there's no such thing as a responder versus non-responder. It's just haven't got the other parts of the training right. You haven't got the nutrition, or you haven't got the mental, the mental preparation right. The other school of thought is, yes, there are differences between individuals, and I'm kind of in that camp. It comes to, that last thing I said, you give somebody some hypoxia and one person can be completely different. Their response to their hypoxia can be completely different to somebody else. And so there's some sort of there is some sort of physiological and genetic, difference between individuals, effects of hypoxia on those individuals. So I think there is a responder and a non-responder. It's just a matter of working out what it is that is causing that. I know you always said you'd be hesitant to take a junior athlete to altitude, and that's because they haven't developed enough of the systems. So maybe it's something like that. I'm not sure, but I think there are responders and non-responders.
Yeah, I tend to agree. In my experience also is that it's more than just altitude. It's all those other things which you do at altitude, which are as important as the hypoxic exposure. So what we often see in athletes, that they get very impatient when they're at altitude because they can't train at the same intensity levels or the same pace as what they do at sea level. So they try and force that. They also need a period of adaptation where for the first week they can't really do much. They should just be almost sedentary or do some light training to get those initial adaptations going before they step up their training. And a lot of them have difficulties doing that, mentally. So The training aspect of altitude is a huge part of if it's going to be effective or not. And the American model says, well, everybody responds to altitude, but you have to find the right altitude stimulus for that particular person. So there are strong responders, and there's a scale of response, but everybody responds if you get the right combination of training and altitude, which can include just being at altitude, training at altitude, which is still the most practiced. The conventional altitude training model is still the most practiced model, while the science says living high, training low is more effective. But because of the logistical issues, athletes and coaches are not buying into that. So all that sort of plays a role.
Yeah. Also, I think when we train athletes just with the hypoxia at sea level, so live low, train high, what we also get is they feel really, really good. And so they feel really, really good. They train harder and they think it's going to improve. And so they almost overtrain themselves. And so their performance goes down. So I think there's a bit of that as well. Yeah.
So training at altitude, even at on a hypoxic machine, there's a higher risk of overtraining, and because it affects recovery.
Yeah. There's a question at the back. Yeah.
Yeah, I was wondering, does the pressure contribute to any adaptations or any of the stress like baric or hypobaric?
Yep. Yeah, that's a good question. There's a debate about whether going to real altitude, like hyperbaric altitude, so where the pressure is different, compared to normobaric hypoxia, which is where the pressure is the same but you've got less oxygen, is different. And some say yes, some say no. I don't know whether there's. They've figured out whether there is. Some would say, look, you've got to go to high altitude to get those really good physiological effects. But we found some changes without having to go to altitude. So in normobaric circumstances.
My instinct is that there is a difference, but I keep asking the scientists, why is there a difference? And they can't answer that as yet. So it's a fascinating topic.
Yeah.
Probably a two-part question. One is if you don't have access to hypoxicators, tents, rooms, or altitude, what do you have any comment around the benefits of using heat to maybe stimulate some of those similar kind of adaptations around plasma volume? And the second part is combining those two effects.
Right. So heat. So heat. What heat does is it creates. Eventually, what happens is you get an increase in blood volume. All right, and so that's kind of what you're doing with some of the physiology when you go to altitude. You get an increase in red blood cells, but you also get an increase in the plasma part of the blood. And when you heat train, that's what happens. And so yes, so sometimes you can get a beneficial effect. The research I've seen about combining the two doesn't have an additive benefit. So you're doing two things and it doesn't add to it. You get the change, but it's not additive. You get a 2 or 3%, and putting heat on top of it doesn't add any more to it. So you're just adding more stuff to the training of the athlete. If you're not, on the first question, there was a research study I looked at last year where if you don't have access to all of those things, you can actually get people to hold their breath, and and do altitude training by holding their breath and making their body become hypoxic. I've never seen it in action, but it's an interesting topic.
Christian here.
Yeah, just on that, I was reading recently about a breathing technique that I think puts you into hypoxia, because it was talking about the same benefits that you are about reducing your oxygen levels and how that can be good for you.
Yeah.
So there are obviously techniques that you can do.
Yeah. You don't want to hold them as long as my son does, because when he was young, he'd hold his breath and fall over.
Mike, age dependency here going into hypoxic training, as we have a young athlete going through puberty, entering into early career stage and things like that. Yeah. Where does that sit as to when? Is there a time and place for the hypoxic training?
So John would say probably, leave the hypoxia until you get them, until the athlete's a little bit more mature. There's other things going on that you can help them with and get right before you add the other stress of going to hypoxia to get the improvements you need. Right, John?
Yeah, our philosophy was always get the basics right first. And the basics are the training, so they have to develop sound training habits, their nutrition, energy intake, and their mental attitude, their mindset. So those things they have to get right first, and that take years.
Yeah.
And then you can do something extra. Then you look at performance enhancing things like supplementation or going to altitude or equipment or other stuff. But first they have to get the basics right.
Okay. Thank you.
Has anyone compared doing the same sort of study with a population at sea level versus a population that lives at high altitude normally, and would the high altitude population get the same benefit on?
So that study I showed you with the purple guys, they were living at from 400 meters to about 2,000, 2,500. So that's just a cross-sectional study. So it's only associations you're talking about. It's not, it's not proof that it's doing it. It might be something else, might be a diet, might be, something else in their lives. But that's the only one I've actually seen that shows that kind of change. Interesting though.
Money.
So most of the research that you've seen or that most of us have seen is from living low and training high. Is there training where you have an altitude chamber or a hypoxicated machine that can reverse engineer it and then actually increase the amount of oxygenation in a low altitude environment? And then with that environment versus sort of live low, train high, get the same benefit or different?
There's all sorts of things you can do. In Colorado Springs, for instance, I know, because it's up at 2,300, 2,800, something like that, the oxygen levels up there are, the partial pressure is lower there. So when they do high intensity work up there, they actually have a mask on breathing higher oxygen so that they can do that work. So there's all sorts of ways you can do that. So Randy Wilber's somebody that's done that sort of research.
Well, I think that brings us to the end of the time. It's been absolutely fascinating learning about your research, Mike. And I think it's been a privilege to see you work within the Link University environment here, and particularly development of not only your own research, but also the development of our sports scholarship program here at the university, and really strong support over that over many, many years. And the development of athletes through that has been one additional aspect that Mike has really contributed to, and the university has been greatly privileged to have that contribution of Mike towards that. So thank you very much for the presentation today. It's an opportunity to go out into Waimarie and to have some drinks and kai out there to have further conversation. But it's a sign of our appreciation, Mike. A few things in here for you. Okay.
Thanks very much. Cheers.